So, hello, I'm Colleen DeChancy. I am the pre-K through second grade learning specialist here at the junior school.
And my name's Katie Wilson, and I am the 3rd through 5th learning specialist at Shadyside Junior School.
So we are here today to talk to you a little bit about what learning support services are here at the junior school. And it's not going to be just Katie and I talking, but we've invited other people to join us as well today. We have our school psychologist who works with us through the intermediate unit, Lisa Rendall, and we also have our speech and language therapist from the intermediate unit, Lisa Harvey, who have joined us here today too, because we're all part of the team that works with the children for learning support. So I wanted to start today just by addressing a question that parents often have pop into their mind if they either hear the term learning support services or learning specialists. So this is what we often hear. My child is working with a learning specialist. Should I be worried? This is the face we often see when we call someone, when we email someone, whether we meet someone in person. Often we're encountered with a confused look, a worried look, but we're here today to show you that there is no need to worry. We are really quite friendly. And we just kind of wanted to dispel some of the myths that there are about learning support and what the learning specialist does. And we wanted to kind of tell you about what role the learning specialist plays here at the junior school, what it looks like on a normal day for us, what we do from day to day, and even what happens behind the scenes.
So what does the learning specialist do? We do all sorts of things, but one of the big things is we work with all the kids to provide support so they get the curriculum, so they can understand it. We provide scaffolds, whatever is needed to help that student do well in their core curriculum classes. So that can look like a lot of different things. We can push into classrooms and work with kids one-on-one. We can work with the whole class while we walk around and assist the teacher. We can pull kids and work with them one-on-one, provide visuals, whatever it is that they need to do well and be successful in class.
And it takes different forms, really, in terms of what it looks like on a day-to-day basis. When I think of what my schedule looks like on a typical day, I might be running over to the pre-K building and pushing right into their playtime and sitting with a group of children on the floor working on fine motor skills. Then I might run back over here to our big building where I will pull a small group of kindergartners and take them back to my room where we're playing a game with letters, engaging 3 or 4 students in a small group. After that, I might then go to a second grade classroom where I'm working alongside the teacher to introduce a math concept, and then we're splitting the group into 2 small groups so that each of those small groups has a teacher working with them. So it can be individual, it can be small group, it can be push-in right in the classroom. You see various things each day, and it really is flexible based on what the students need. We are constantly really just reflecting on how the students are responding to instruction and what we can do to work with the classroom teachers to make that instruction more accessible and more meaningful to the kids. What we are is another teacher. We are people who have been in the classroom ourselves as classroom teachers, and we know what it's like to be the classroom teacher, so we kind of just join alongside them and say, what can I do to help you? And it doesn't have to be with the student who's struggling. It might be with a student who just needs an extra push. Mm-hmm. It might be that it's just simply too hard to do hands-on learning with a group of 15 or 20 students, but if you split them into 2 groups with a teacher with each group, then it's a lot more accessible to them to do different types of learning experiences. So, like I said, it can be within the classroom, it can be outside of the classroom, and it can be a combination of both, too, even for one student. One student in math might need support outside of the classroom one-to-one, but in reading, they might be right in the classroom and just need, a smaller group in the classroom, like in a center, to rotate through and have a different teacher teaching that center. So, our days are definitely very interesting. When I make my schedule for the day, I get to be so many different places, doing so many different things, and engaging with the children and the teachers in so many different ways. So no day is ever boring.
It's not. And we reflect a lot too. We go back and we talk and collaborate with the teachers after we work with the kids to see, hey, how did that go? How did that work? Did this help them? And really try to be reflective in the things that we do as well.
And when we're looking in terms of how regularly something is happening, maybe we have a certain student or group of students who is struggling just in a certain area. Maybe in kindergarten, the classroom teachers have noticed that the certain group of students just isn't understanding the concept of rhyme. So I might then pull that group of students to my room and do some activities around rhyme. Maybe we'll do it for a week or two, and then I'll say, you know what, they get rhyme now. I don't need to see them anymore. So it could be very short-lived. It could just be based on a certain concept, or there might be children who just need a different pace of instruction, or children who learn better if it's presented to them in a smaller group, who are too distracted maybe in the big classroom, and it appears that they're not getting it, but when you take them in the small group setting, you see, yes, they're really getting it. So it really does take different forms, and it can be either regular or just as needed, and it's constantly changing. So that's what our day looks like on the surface. You'll often see us just running from place to place, grabbing different supplies and joining different teachers. Behind the scenes, there's a lot of things that we're doing too, just to make sure that we are providing the best learning experience for our students and providing the best support for our classroom teachers. One of the things that we do behind the scenes is we track student progress on assessments. The teachers are regularly communicating with the learning specialists on how students are doing with different assessments that are tied to their curriculum. We know when there's a test in math, for example. After the test, we regroup, we sit together, we look at the scores, we analyze the scores, we have documents that actually look at each question on the test so we can see, oh wow, there were 10 students who did not get this concept. And then maybe we might plan, how will we approach reteaching this so that they get this concept? So it's not just the test is over, this is your grade, let's move on to the next chapter. We're really looking at it and trying to analyze and reflect on the results so that we can inform our next move for instruction. Likewise with reading levels, understanding where a student is reading and tracking their progress to make sure that they're meeting the grade level benchmarks. And if they're not meeting grade level benchmarks, making plans to help them to get where they need to be by the end of the year and keeping track of that progress and communicating it with parents as needed. To do this, we obviously need to be meeting with the teachers regularly to discuss how the students are doing in class, because obviously we're not with them every day. So what we do is have grade level meetings that happen throughout the month on scheduled days and times when the students are in their special classes. We meet as a team along with Dr. Mathis and Katie Boss, our guidance counselor, and we sit as a team with the grade level teachers, and we discuss how the students are doing in their class, whether it's social, emotional, behavioral, academic. We talk about the students and their whole experience here, and if needed, come up with a plan of action on how we can help those students to make the learning more meaningful to them and to make it more accessible to them. Another thing that we do, which is one of my favorite parts, is we get to go into the classroom to do observations. Sometimes a teacher might not be understanding why a student isn't understanding something, or not picking up on why a student is maybe having trouble working independently or sitting on the rug when they're supposed to. And as the classroom teacher, it's really hard sometimes to analyze the why when you're the one delivering the instruction at the same time. So sometimes just having someone else come in as another set of eyes can help, so that we can do an observation that we then write up and can read together and look at and say, oh look, here I noticed that this student was looking over there. I think that window is not a really good thing for him to sit next to. Maybe if we move his seat over here, it might help him to focus more. That's just an example, but sometimes having that observer in the room to see something that the teacher might not be able to catch because they're teaching is really helpful. So that's something that we do and that Katie Boss, the guidance counselor, does too. Sometimes we'll do one and Katie Boss will do one, and then we'll compare notes to see if we're seeing different things. But it's a big part of what we do as well. Moving outside of the school, we also help to coordinate with any outside service providers. So that could be behavioral therapists, it could be occupational therapists, students who get speech therapy outside of school, or physical therapy, or doctors that they might be working with, or psychiatrists. Any outside service providers, tutors as well.
Materials needed.
Right, right. So we are kind of the point person for that. So emailing with tutors, phone calls with tutors, making sure that we're all on the same page and doing the best we can to support a student is really important so that we have that consistency both outside of school and in school. So we're kind of the point person for that. Also, when it comes a time where a family has those questions, especially thinking back to those worried parents on the first slide. When they're thinking, what should I do? My child is struggling. I think something doesn't seem right. We work with families. So we meet with families to talk them through that, to let them know what we can do to find out more. And when needed, we set them up with the resources they need to get that information, whether it be an educational evaluation to find out more about academics, or if they need to find out more about how the emotional piece is affecting their child's learning, maybe seeking outside services from a neuropsychologist. It really depends on the situation, but we're there to counsel families through that and really use what we've learned about the student through our observations, through talking to their teachers, through working with them to figure out the best course of action to help that student to do their best. When we do find out through any kind of testing or through diagnoses from various evaluations that there is something that makes a student learn different or need accommodations, we are also the people who write the accommodation plans to make sure that the supports that students need are in place, and we then communicate those with the teachers. So there's a lot of things that happen behind the scenes while we're doing the teaching too. And it all just centers and comes back to the student and their families. Mm-hmm. So I know that's a lot to take in.
We keep the kids in our center. They're our focus.
Right, always. I mean, always coming back to that idea of, well, what is best for this student? What does this student need, and how do they learn best? How do they learn is a huge question. Because just because it appears that they don't know something doesn't mean that they don't know it. It might just mean that we haven't been able to find the pathway for them to access what they know and show it to us. So it's fun. It's kind of like working through a little puzzle and a mystery sometimes to figure out what works best for a child. We've invited our two Lisas here, Lisa Rendall and Lisa Harvey. Lisa Harvey, like I said, is our speech and language therapist, and she's here, Lisa, is it 2.5 days a week?
Yes, 2.5.
So she works with students from kindergarten to 5th grade, providing speech and language. So I'm going to invite Lisa to come up and talk a little bit about what her role here is in supporting students.
Before we transition, we have one online question.
Oh.
How often are accommodations reviewed?
Okay, so in terms of accommodation plans, typically depending on a student's needs or their diagnosis, it's typically they get a new plan every 2 to 3 years, but also they can be reviewed as needed. If we're finding that the current accommodations are not working for a student, we can open them up and review them at any time. But if things are working well, then we typically reevaluate and do another plan just to adjust for their age and their growth every 2 to 3 years. Yes?
Can I ask another question before we transition? Can you explain or go in depth a little bit more about how you work along with Katie Boss to try to help a child who may be receiving help from either you or Ms. Wilson to understand why they need that help? Because I feel like that's a little bit of a missing piece that they're not quite sure why they're getting this help really, or why they're different than other children in the class.
Right.
And they get a lot of questions about why they're being taken out of the room for testing, or why they're
Right.
going to your office for a little bit of time. So can
And
you talk little bit about that?
really good question. One of the things, and one thing that pops into my head right away is because we do have certain students who need to take their tests outside of the classroom. And that's something clearly in a small school like this, other students do notice that this person's going to another room to take their test. And that student who's going might wonder, why am I going? And another student might say, why is he going and I'm not? One of the things I do at the beginning of the year, especially for students who are going through that idea of being in a different setting for the test for the first time, is we talk about why. And we have the conversation of how they're able to show their knowledge best. And we talk about how different people, different learners need different things. Some people show their knowledge best and it comes out in the best way when they're in a really quiet space. Some people show their knowledge best when they have the test read to them. Some people show their knowledge best when they're able to read the question out loud to themselves. And for all those things that happen, that allow that child to learn in the way that they learn best, we have to do it in another room. Because can you imagine if everyone who learned differently was doing it all at the same time? It would be very confusing. So we take the learners who need certain things and put them where they need to be. And we have the learners who need to be in a different place to be in that space. Another analogy I often use with kids in terms of helping them understand what they need being different from what other people need is I relate it to something that is really easy for them to understand. I talk about wearing glasses. I wear contact lenses most days, but on the day I talk to my kiddos about this, I always change out of my contacts and put on my glasses, and that always causes them to be in an uproar and say, oh, well, you're wearing glasses. And I say to them, well, I need them to see. If I didn't have my glasses on, I couldn't see you. And I'll even take my glasses off and pass them to another student and have them see what it would feel like if they put my glasses on. They usually go, oh, how can you see out of these? And I said, well, the way my eyes are, that's what I need to be able to see. If I don't have those, it doesn't work. But do you need my glasses? And they go, no, I can't see when I put your glasses on. And I say, well, that's because we're different people. I need that and you don't. I said, my special doctor, my eye doctor told me I need those. So I wear them and it helps me. And I tell the kids that the teachers at school are kind of like that eye doctor. We don't give glasses, but we give kids what they need to know how they learn best and how to show what they know in the best way. And a teacher will give you what you need to be successful. That teacher might not give the same thing to every student because not every student needs it. We are kind of like the doctor who's the expert that will help you to find out what you need. And just like you trust your eye doctor, you trust your teacher and will help you to know what you need to be successful. And typically that works really well for kids because it's broken down in a way that they can understand. But it is an ongoing conversation, and Mrs. Boss is really good at meeting with the kids one-on-one to talk through that more. And also working with the class as a whole to talk about differences. We're working right now to talk about how we can tie that piece of different learning needs to diversity as a whole. December coming up is the focus on diversity for our wellness program, and Mrs. Boss is going to be going into each of the classrooms to address the topic of diversity. And we've been talking a lot about how learning differences are an important piece of diversity that the kids are really relating to every day. So she's kind of planning some of her lessons around that to address with the whole group. So in a way that they can understand, whether it be through literature, through role playing, just things that they can really connect with. Any other questions before we transition? Okay, so sorry, Lisa. Go on up. We're going to talk a little bit about speech and language.
Okay. Is this a good spot? Okay. Hi, everybody. I'm Lisa, and I'm just going to speak a little bit about what I do, and then if you have any questions, I'm happy to answer them. So I'm a speech-language pathologist or speech therapist or speech and language therapist. Any of those names are fine. A lot of the kids call me their speech teacher, which is okay by me. And I work with the kids from kindergarten through 5th grade, as Colleen said. And what I do is I help students who have speech sound disorders, language disorders, voice disorders, fluency disorders, or swallowing disorders. But typically at this school, I'm usually only working with speech sound disorders, which would mean trouble saying a specific sound, like an R sound or an S sound, and language disorders, which covers a student's ability to understand what they're hearing, so following directions, comprehending stories, and the ability to express themselves, which would cover vocabulary, grammar, sentence structure, and organization to put sentences together. And that also, and then the other part of that would be social language, which would cover interacting with peers and acting appropriately, responding appropriately socially in the classroom. And what I do is I see students one-on-one or in small groups. I would say 90% of the time, I pull them out. Sometimes I'm in the classroom, but usually it's outside of the classroom. And a typical therapy session looks like I would teach a student skills or new skills that they're working on. I'd give them multiple opportunities to practice those skills while I'm giving them consistent feedback. In addition to that, I'm teaching them compensatory strategies as well as scaffolding. So I'm giving them cues from maximal cues to minimal cues until they're able to use the skills independently. And that's pretty much, in a nutshell, what I do for most of the time. The other piece of that would be screening and diagnosis, which a lot of that occurs in the beginning of the school year. I do screen all the kindergarten students and all the new students, and I do track them to make sure that they're developing appropriately. So for example, if a kindergartner is missing a few sounds, but they're developmentally appropriate, I'll check in with them the following year and the following year to make sure that they're meeting those developmental milestones. And I also do a number of evaluations to determine if students have speech or language disorders. And I think that's basically my overview.
Right, and I can say Lisa also works really closely with the learning specialists too. She's an excellent resource, especially I know for myself as I'm working with the younger students who are just learning sounds, and I'm trying to understand how they're hearing them and being able to produce them. I'm often asking her questions. Things like the other day I was asking her, what verbal cues should I give them to help them make the L sound? And she said, just tell them tongue tip up. So, making sure our language is consistent so that those kiddos who are working on that sound are hearing the same thing from her and from me. She often joins us for accommodation plan meetings with parents too, especially for our students who are receiving multiple services. She is a part of the team meeting with the family. So, yeah. Any questions about speech?
I just have one very quick one.
Yeah.
How long, for something simple like you said, like maybe needing to get better at sounding R's or sounding S's, how long is there a finite period where you feel like a child should overcome that issue, or is it ongoing for long periods of time? Or
So it depends on the sound. It depends on the severity and the student and how well they respond or how quickly they respond. So on average, I would say the shortest amount of time that I work with a student would be half of a school year, which has probably only happened 2 or 3 times total out of 8 years. So that's not really common. Usually it's 1 to 2 to 3 years. It really depends on what they're working on. And some students I'll see from kindergarten all the way through 5th grade. So it really varies on a case-by-case basis, but it's usually not a very short-term thing. It's usually longer.
Well, and I know just from working with Lisa and the children that she works with, she doesn't just stop as soon as they're able to produce the sound, but she makes sure that they're using it regularly in their conversation too. Because what I've noticed is a lot of times the kiddos can produce the sound, but they're not applying it in their everyday speech and in conversation. So a lot of practice with that really helps it to stick more. So that takes a longer time.
It takes a longer time. Yeah.
Yeah.
Would you say that same time frame works for social language learning stuff as well? Or is it a little different?
I think usually with social language, With the language in general, it's really hard to say. I've never seen somebody for language for less than 2 school years. So I want to say I usually work with them longer. It's not always the case, but I've never worked, I can just say definitely I've never worked with a student on language for less than 2 years. So I think it's more of a long-term goals.
And then you do have students too who receive outside speech in conjunction with the speech they're receiving here at school.
Yeah, sometimes people want extra or more therapy. If they're seeing me in a group, sometimes they want individual outside of school, and that works for them. So some people do that as well, and some people don't want to be pulled out of class more than once a week, so they'll seek outside speech therapy as well. And in a lot of cases, I always say the more therapy, the better, so go for it.
Yeah, and she does a really nice job of working with the teachers too to coordinate schedules, to make sure that she's pulling kids at the time of day where they're not going to be missing too much. She's always checking in with the teachers to see what works best and kind of altering the schedule as needed for special events or birthday snacks and things like that. Like, she's very flexible and accommodating in that way. Okay, thanks, Lisa. So now we're going to ask our other Lisa, Lisa Rendall. She is our school psychologist who works with us through the intermediate unit. She does educational testing. So if we have a family who is concerned about how their student's doing, their achievement doesn't seem to be really maybe matching up with how bright we can tell that student is, or we have questions about why the student is not giving us as much as we think they're capable of giving. So we ask Lisa to join us then, and she's going to tell you a little bit about what she does to help us with that student.
So if I get a referral to do an evaluation on a student, your consent is always given first in writing. And I can look at a lot of different things. The most common things would be intellectual functioning, which gives us a cognitive profile, academically, achievement-wise, where kids are at, and reading, math, and writing, even listening comprehension. And then if there are concerns about behavior, attention, social functioning, or even emotional functioning, I can also look at that. There's always a classroom observation, and then after I've done all of that, there is a report, which takes on a formal process, and then we all meet and discuss what's the conclusion, is there a diagnosis, what are the recommendations, strategies to put in place, and that's pretty much the process. Did I miss anything in that?
No, I mean, that was a good overview. I mean, I think one of the things that Lisa does best is she really gives us recommendations that are relative to this setting. She's here a lot. She takes that time to do the observation in the classroom, so she's seeing that setting in which the child is every day and making her recommendations in light of our classroom setting, in light of our schedule and the setup we have here at the junior school. So it's nice because when we refer a student, we know it's going to be Lisa who's helping us, and she does know our community. And we really trust her and know that she understands who we are as a school and what our mission is. So she works very closely with us in making her recommendations. She doesn't just pick recommendations off a list and say, oh, a
Try
student,
to be personalized.
right, a student who has these learning needs, here you do X, Y, and Z. We have had students who have very similar needs, but they have different recommendations because they're different kids. And we work really closely to come up with those recommendations, not just with the learning specialists, but with the classroom teachers too. So we make sure the recommendation that she's making and that we're putting in that report makes sense for that child. So it definitely is a very individualized process and very personal.
Just
Yes.
one quick question. I know this came up at our coffee earlier in the week, and I want to make sure it's available to the people online. Is there a cost associated with having that testing done?
No, there is not.
Okay.
Right.
So you only associate a cost with you would hire an outside professional.
Right, and I mean there are outside evaluators who go a little bit deeper, they're a neuropsychologist, for example, instead of a school psychologist. And some of them do accept insurance, but yes, there is a cost associated. But all of the tests that Lisa does in terms of IQ testing for the cognitive functioning, she also does achievement testing, and that's what helps us to see if there's a discrepancy between what a student's capable of and what they're actually doing. To see if there is a learning difference. She is able to do all of that here in-house at no cost. That's provided to us as a private school through our intermediate unit. And we're really lucky to have a good person to do it for us. Thank you.
So, this is probably overly specific, but when you go outside, sometimes those tests can be like 4 to 5 hours long. How do you schedule that? With here?
So here at school, I really work closely with the teachers to figure out what's the best time for the student. And if when I'm working with a student, if I see they need a break or, they say, oh, gym classes now, I let them go.
So you just kind of piece it out. Over.
Yeah, absolutely.
Right, and
So the idea
she
is
comes
for
and
the
a student's
student
sick,
to
she
be
comes
comfortable.
back,
Right, yeah.
Her and I are constantly emailing and finding the right dates. She'll ask, is this a good day to come and do an observation? We'll ask the teachers and say, oh, you know what, there's a guest speaker that day. That's not a good day to observe. Let's set up another one. So, that's another one of the learning specialist jobs is to communicate or set up that communication between Lisa and the teachers to make sure we're getting the best possible times for that testing to happen.
That would work really well for kids who struggle with transitions or new places or.
It is nice because they're right here, like usually typically we have her right in our conference room, which is right next door to my office, so that, the kids are waving at me as they go by and they see her here a lot. She's in the classrooms, she's in the hallway, she's a familiar face. So she's like another teacher here at our school and they don't have to feel intimidated. Any other questions about the testing? Okay. Thanks, Lisa. So I wanted to invite 2 of our parent community members up to talk a little bit about a really exciting new initiative we have called the Neurodiversity Squad. It's something that we are kind of kicking off and we're really excited about in terms of all the ways different people learn. We want to get a group together that will help to celebrate that and help us to learn more about it. So if you would like to come up.
That's fine. So, hi, I'm Lisa and this is Penny, and we are parents at the school, and we wanted to start a neurodiversity squad for any parent, mentor, caregiver of a minor child who would like to find out more about ways that you can provide support and learn more about children with learning differences. So my child has ADHD and everybody seems to know about it, and she said it was fine if I became sort of the front person for starting something like this. Even just mentioning it across the school, people have expressed relief to me that they were looking for ways to establish a sense of community. And already I've had really interesting questions about how, for instance, a coach can mentor a student who may or may not have accommodations that someone knows about, but is definitely exhibiting some difficulties learning some things or trying to figure out some things. And I think that our group could certainly work some things out formally and informally so that we can learn some things. So primarily we want to provide support and establish a visible community. I think that's our main goal. So.
And I think it's important to note that it's not just for people who might have children with a neurodiversity. It could be for that child's support system, their friends, their, family members, whoever feels like they could benefit from learning what it might be like for that child and how they can better support them. Because we had one parent express interest in, it's exhausting to maybe try to help a child with a neurodiversity get through the day, or to get through a sporting event, or to get through whatever it is they're getting through. It can be emotionally draining to them to always navigate
Right.
why they're kind of off on their own or doing something that might be disruptive. So it's for the whole community, really. It's not just for people
Right.
who have a child with a neurodiversity. We will have
Sorry, yeah.
some contact information that you can give us your name and your email address if you'd like to hear about the next steps. There will be hopefully a planning session or a
Yes.
kickoff session in January.
We'll have an email blast. We'll ask people for their information. Our goal is first we'll get a survey to see what kinds of things people would like to start with first or the most, and then we should have our first meeting in January. So we'll have the survey out probably in December, and then our planning session, and then our first meeting in January. So look for it.
Great.
Yeah.
Thank you.
Thank you.
Yes, and as they mentioned, we will be, through the school, we will be sending out an email with more information about the Neurodiversity Squad and contact information of what you can do if you would like to learn more or get more information. That email blast will be going out hopefully later today. So, are there any questions or anything else that anyone wanted to chat about in our last couple of minutes? Anything online? No? Okay.
Nope.
Well, thank you. And if anyone ever needs anything, you could reach out to me, Colleen DeChancy here at the school, just cDeChancy@ShadysideAcademy.org, or Katie Wilson as well. It's kwilson@ShadysideAcademy.org. We're here and happy to help or answer any questions you might have. Thanks.
Thank you.
Thank you.